All right. Hey, everyone. Thanks for joining with this episode of Campfire Chats. I'm joined tonight by Dr. Andrea Bischoff, who is clinical psychologist by day and Nevus mom by night. And Andrea, I'm so glad to be here with you. And I know that the Nevus community will really appreciate all your back to school tips as we think about what it means to prepare our kids, both with backpacks and water bottles and lunch boxes, but also the tools that we need to be successful, and how we show up with mental health and just navigating a system that is sometimes a little bit challenging for kids with CMN. So, welcome.
Thank you,
And
Lauren. I'm so excited to be here.
absolutely, tell us a little bit about your background, what brought you to the Nevis community, and kind of what gives you a unique perspective on these topics.
Absolutely. So, like you mentioned, I am a clinical psychologist. I've been working as a clinical psychologist for about 18 years now, primarily with adults, but I do have a background of working with children as well. And my youngest child, Evelyn, is our Nevus owner. She has a bathing trunk Nevus and she's about to turn 11 and entering into grade she entering into fifth grade this year. And back to school or entering school for the first time can definitely bring up some worries and concerns, both on the side of parents and our kids. So I think it's always a great idea to just do a little bit of a refresher or a refresher on just what to think about when we help our kids enter into new environments or re-enter into an environment where sometimes their visual difference, sometimes the nevus definitely comes up with peers and maybe some of the adults in the school. So see if we can set everybody up to succeed and have a fantastic school year.
Absolutely. Well, I have just a few questions for you. So, as a parent, people might be wondering, how can I help my child respond confidently to others with questions about their Nevis from classmates and maybe even teachers?
Absolutely. So this is probably one of the most asked questions, whether it's in the school setting or another social environment, is how do we prepare our children to respond appropriately and confidently? So first, it's to just validate those feelings, validate them for yourself as a parent, but also for child. This is hard to navigate. It's hard for us as adults to navigate and to figure out how to respond appropriately. So it's going to be difficult for our children at times as well. And just knowing that's okay. That's part of life. It's part of what we're here to help them do. The first thing I recommend is, as a parent, to figure it out for yourself and giving yourself a script and practice, right? Practice, practice, practice. So, whether you want to have a script that is based in education, this is my child's Nevis, it's okay. It's not anything that's painful. They're doing great, and moving the conversation on from there. Sometimes people will have a script where they kind of make a little bit of a joke about it, or just calmly tell somebody that it is a birthmark and find something that they identify with on the child or the adult. Like, oh, it's Evelyn's, my daughter's name's Evelyn. It's Evelyn's birthmark. You know, I see you have a rainbow on your shirt. She likes rainbows too, and help move that conversation along. So prepare as a parent, so then you can help your child do the same, right? Because our children are always watching.
Mm-hmm.
So prepare a few scripts for them to say and practice it. Go out in public, or practice with peers, trusted peers or siblings, to get that script down.
Yeah.
Yeah, and
That's
just
such
build
good
in
advice.
those reps. Mhm.
Yeah, that's such good advice. I think the practicing part is really important. I know for the longest time we used the script it's Maylee's birthmark. Do you have a birthmark? And I mean, I saw lots of kids birthmarks, or if they didn't have one, they would grab a sibling or, or something to say, oh, but my sister does. And, saw lots of, we used that trick for a long time. And, it evolved over time as the kids get older. Like, so if you did it in kindergarten and they're now in middle school, you might want to revisit it and ask them about what they feel comfortable sharing. I mean, that's, part of the conversation too. So, just to make
Yes.
sure that it's always age appropriate.
Yes, and most children, it's rarely the children that have a problem that
Hmm.
they move on easily once they learn that our children are fine and comfortable. They accept it. Sometimes it's the adults who have a little bit more curiosity or probing questions, and also teaching your child to just say, you know what, I don't want to talk about it anymore, and assert themselves. That's okay as well. So finding that
Absolutely.
balance, yeah,
Yeah, that's that social emotional intelligence. This
yes.
CMN like really helps us like bring those skills to light really quickly. So yeah, that's
Yes.
absolutely true. So let's talk about anxiety for a second. I in talking, obviously talk to Neva's parents all the time. Anxiety is a very common feeling that comes up quite often. I've experienced anxiety around um, managing Maylee's Nevus for years now at different times. So, what are some effective ways to manage anxiety or self consciousness that my child might feel or I might feel as a parent about returning to school and just in general living with a visible difference? That's kind of a loaded question, but
It can be a lot, but especially when we go back to school, things is making sure that um, as a parent, you go to the school, talk to them proactively, talk to the teacher of the classroom or the classrooms that your child's going to be in, talk to the administration. What is their policy? What is their policy on bullying? What is their policy on how to handle interactions before it turns into bullying? Many of our
Mhm.
kids aren't bullied because of this. In fact, a lot of our
Mhm.
children are really confident, and that will defer from kind of that bullying experience, but they will be teased. All kids get teased at some point about something. And
Mhm.
so, proactively work with the school, educate the teachers on what CMN is and how to talk about it, how your child likes to talk about it. And
Mhm.
then with your child, walk through the routine, go to the open houses or the orientations if your school has one, talk to them about what they will do in the morning if they will ride the school bus or walk to school, what their routine will look like throughout the day, and walk through those scripts that you've practiced that we just talked about. How will you handle if a child says something? If you're in the lunchroom and somebody says something, what will you do? Who are the safe adults to go to? Who are the safe peers? Oftentimes, our children will develop friendships with peers who will share their voice and kind of take up for them. We want to connect those children, make those bonds strong, and allow them to rely on each other to help. Because there's a likelihood that that other child will get teased about something, and our kiddos can help them as well.
Yeah,
Um,
yeah.
yeah.
Those friendship relationships are important too. And
Mhm.
um, I know I appreciate us being in like a little bit of a smaller, given the choices in our area, a little bit of a smaller environment. Um, I think that has helped like most of the kids know Maylee pretty quickly. And just the questions from people that may not have interacted with her before kind of keeps that as a minimum. I know that's not a choice for every family, but I do see that kind of just anecdotally talking to a lot of parents. A lot of parents do choose when possible, a little bit of a smaller environment just because that makes it just a little easier. Um, but
It,
you know,
it certainly can. Growing your village, growing your child's village, creating those advocates and those allies, and strengthening those relationships is so important.
yeah.
And then teaching your child it's okay. People ask questions. Um, Children ask questions, even about little things that maybe people aren't as sensitive about, if it's a shirt or a color of hair, eye color, things like that. So helping them remember a lot of times these questions come out of a place of just curiosity and
Right.
genuine caring, not coming from a harsh or mean place, even though sometimes it can feel that way. So helping a child see a different way to interpret these questions, so they don't interpret them through a lens of teasing or bullying.
Right.
If helping them to learn the difference and move
Yeah.
on quickly, is
Yeah.
important.
So what about sun safety at school? How can a parent advocate for that? Sometimes that can be a challenge depending on, what the setup is and how many. I'd like to hope that these kids are getting to run around and play outside as much as they can during the school day, or things like that. But are there tools that parents can use to advocate for appropriate shade or water breaks or whatever the case may be?
Absolutely. So during those preschool meetings that we talked about with teachers, with administration, that's where you want to, as a parent, talk about not just what CMN is socially, but what your child may need, whether it's definitely sunscreen at recess. Hopefully they get outside as much as possible. Maybe sunscreen before they leave the day, to go home. It could be overheating, whether that's in the classroom or outside before it gets cool. Um, so talking with the administration about what they may need for sunscreen. Some schools require formal documentation from the physician, whether that's the dermatologist or the pediatrician, making sure that you are able to get that into the school timely, so that they know exactly how much sunscreen should be applied or what sort of breaks your child may need. Um, for many schools, that might require doing a what's called a 504, which is helps our kids get medical accommodations in the school, in the classroom. So having those early meetings, talking with pediatrician about what they recommended, or the dermatologist about what they recommend, and having them complete that. Some schools don't require the formal documentation for some of that. Some of that they just route it through the teachers. I know my daughter's school is like that. As long as the teachers know what she needs, they can help me reinforce it. And I started at a young age teaching her how to apply that sunscreen herself, to make it even more readily accessible, both for her and to lift that off the teacher. So as soon as she was able to apply it to herself, she was pretty proud about it. Gives them a sense of independence, a sense of pride. And then just working with the teacher and having that communication, creating that early partnership between yourself, the teacher, and the school and the child is so important. So then you can check in if the sunscreen bottle isn't empty within about a couple months. Maybe you need to check in. Or are they putting that on? Are they helping remember? Because as the child gets older, it may be something that may be fun when they are young, might feel like a burden to them as they get older. So it might take more of a teacher support to help remind and prompt them to do those things.
Absolutely.
Um,
It's funny how the behavior that once was fun, it's not
yes,
so fun
yes,
as they
yes.
get older. Andrea, anything else you would like to add in terms of um, just advice you would give parents or things people might need to know as they go back to school?
Just to really communicate open and honestly with the school, with the teacher, and with your child. Use age appropriate language. Check in with your child, see what they need, what they're worried about. Ask how things are going. We have some great resources through the membership portal on nevus.org. Whether it's
Yes,
the teacher education information, because our teachers often haven't seen this either. They've seen a lot of things, but they probably haven't seen CMN. And just leaning into the education and remembering that bringing the school in is yet just one more partner, and your child's village will help tremendously with their success.
yeah, absolutely. Thank you for mentioning the resources on the membership portal. We do have a teacher's guide on there that was developed with Andrea and another clinical psychologist, another Nevus dad, Dr. Sean Reynolds. So the two of them collaborated on that. And so that is available. We also have just kind of a Canva template that has that you can personalize for your kid and send that to school to give a little bit of their just history at a glance and what the teacher might need to know. There's also membership cards, or not membership cards, awareness cards that are like little business card size information that says, hey, my kid has CMN, and this is, you can go here to get more information. If you don't feel like having a full conversation, you can just hand somebody a little card. That's kind of nice for some folks. And then there's also like a children's book list circulating in the Facebook group. I know, Andrea, you were instrumental in kind of building that list once upon a time when Evelyn was a bit smaller. Mm-hmm. So yeah, there's that, and that list has continued to grow. So search the Facebook group for that. That'll pop right up. And I would like to check that list, and maybe we can consider that for next school year and see if there's any new resources that we would add to it. And who knows? I'm dreaming a little bit. I would love to create our own Nevus Outreach children's book someday, where we've got illustrations of kids with CMN, but then they're real photos accompanying it. And so maybe that if you've got a little baby, maybe I'll have that by the time they go to kindergarten. I don't know. We'll see. Dreaming big around here, but always thinking about what's next and what we could do to better support families in this journey and every step along the way. So Andrea, thank you so much for joining us. And I'm just really grateful to have your expertise at the table, and also your care as a Nevus mom and just a committed member of this community. So thank you so much for joining us tonight.
Thank you for having me. It's great. And if anyone has any questions, they're welcome to reach out to me personally as well.
Perfect. Thank you so much.
Bye.